Healthcare nightmares often start small, a little bit of pain, a persistent cough, or a lack of energy. For Eileen Rubin, it started in June of 1995 with an excruciating backache that wouldn't go away. Her doctor thought she'd pulled a muscle.
I had been to the doctor the day before, and I wasn't able to even walk into the office. I needed assistance. I had some blood taken. I had a chest x-ray the evening before, and my blood pressure was 70/50. But I was sent home, and in the morning, the phone rang pretty early, and it was this doctor. And after my husband picked up the phone, he said, Eileen is a very sick girl. She needs to go to the hospital immediately.
But Eileen had other things to do. She was a local prosecutor looking forward to starting a family. She didn't have time to be sick.
I think I protested. I said, do I have to go now? I can't wait. And he's, no, you have to go now. This second, your white count is 3 times higher than normal.
Eileen clearly had pneumonia, but that didn't explain everything. And her condition was deteriorating faster than the ER doctors knew.
I remember looking around and beseeching people with my eyes. And I finally said to my mother, I can't breathe. I think I'm dying. And she ran out of the room and called over the doctor, and the doctor said, no, she's fine. She's fine. I was just in there. She's just nervous. She's anxious. And finally he came in the room and he saw me, and they cleared out the room. And it was hours before anyone could come back in. When they came back in, I had been intubated. I had numerous machines hooked up to me, and I was in a drug-induced coma.
Eileen had Acute Respiratory Distress Syndrome, or ARDS, triggered by pneumonia. ARDS is a fluid buildup in the air sacs of the lungs that prevents the transfer of oxygen. About 150,000 cases a year are reported in the United States. More than 60 different traumas, infections, and viruses may prompt it, but usually it develops after a patient is already in the hospital.
It is an acute lung injury, so there are a lot of different things that cause ARDS. It's not a one thing causes this. It can be from infections. It can be infections in the lung, but it could also be an infection somewhere else that causes activation of inflammatory mediators in the body. It can be from burns. It can be from major trauma. It can be from pancreatitis. All those things all end up injuring the lung, and it all looks the same when we see it.
That's pulmonology and critical care specialist Dr. R.V. Stone.
There is no specific treatment for it. There's not a medicine that you give people and it goes away. The key to treating this is just support. It's very simple. It's supporting all the body's functions while the lung is recovering. In some people, the lung injury is so terrible that the patient actually dies from inability to get oxygen into their blood. For the majority of patients, if you can support them with a breathing machine, with oxygen, with fluids, with antibiotics, that over the course of a week or maybe 2 weeks, they get better. Now, it's going to take a while to recover from that very devastating illness. So the portion in the ICU, on a ventilator, on a lot of medicine, that takes a week, 2 weeks. The recovery from the illness, probably another 2 to 4 weeks.
Eileen's 4-week-long drug-induced coma and 8 weeks on a ventilator were designed to let high-tech equipment take the load off her body. But Stone says if she'd been diagnosed more quickly, she might not have been in so much danger.
Well, I think that her primary care physician probably didn't really recognize what was going on, so there probably was a delay. You know, you can't predict anything with 100% certainty in medicine. Certainly you cannot, but I think that her chances would have been better of avoiding this whole illness if she had gotten the right antibiotic at the right time.
Today, doctors are much better at looking for ARDS than they were back in the mid-1990s. That's been one of the goals of the ARDS Foundation, started by Eileen and other people affected by the disorder after they looked for information on the syndrome and found nothing. Today, the foundation offers support and information on ARDS, funded through events such as the ARDS Walk, where we caught up with Eileen's mother, Roberta Rubin.
We're very grateful that she was strong enough to go through this and survive it. It was a very difficult time because pretty much on a daily basis, the doctors told us that they expected her not to survive. And then at one point, they called a family meeting, and they said that if she did survive, that she might never be, quote, normal again, that they didn't know if there was brain damage or what was going on. So our focus at that time was not to really put blame, but to try and do the best that we could do to help her survive this.
Back in 1995, survival was a coin flip. Since then, Stone says that's improved.
Well, I haven't read the latest percentage. I know in years past we used to say it's about a 50-50, but now I think things are a little bit better. I think we understand this disease a little bit better. We've gotten a little bit more uniformity in how we manage it. There's more pulmonary and critical care specialists out in the United States that are trained to take care of this disease, so that our survival rates are better. I'm not going to say it's 100% survival, but I would say that you're probably 70% survival now.
But one thing hasn't changed since 1995. The long-lasting effects of ARDS are still a concern. Stone says someone who survived ARDS may never completely get over it.
One of the first things that was looked at was, does lung function come back to normal? Because that would be the most obvious thing to look at. And probably the majority of patients who survive ARDS, their lung function goes back to normal eventually. But there's a good percentage of them who are left with some restrictions, some failure to go back to totally normal. Studies are coming out showing that there may even be impaired cognition years after the whole ordeal. So we're still learning what the effects on the survivors are.
Fortunately, Eileen hasn't been affected long-term, except for her determination to help others who find their lives endangered by this little-known disorder. And that makes her mother very proud.
Oh, we're very proud of her. We've always been proud of her, but we're extra proud of how she's managed to come back from this illness and be a mother, be a lawyer, and still be so involved in the charity.
You can find out more about the ARDS Foundation at ardsusa.org. Our writer-producer this week is Bill Ezrin. Our production director is Sean Waldron. I'm Nancy Benson.